This video, which is based on the 2015 ESC guidelines, will present risk factors associated with poor prognosis in patients with acute pericarditis. The official guidelines can be found online via the link below. Risk factors associated with poor prognosis in patients with acute pericarditis include fever, that is, body temperature greater than 38 degrees Celsius, a subacute course, such as the presence of symptoms over several days without a clear-cut acute onset, immunosuppression, evidence of a large pericardial effusion, cardiac tamponade, or myocardial inflammation, failure of symptoms to improve or resolve with NSAID therapy within 7 days, history of acute trauma, and oral anticoagulant therapy.